Problems related to the back and the spine are the #1 reason people file Social Security disability claims. And every day that I do disability exams, I see several people with back problems. Today, I'm going to talk about back problems and disability, and hopefully this will be helpful to people applying for disability with back problems, or considering applying, and maybe even helpful to physicians new to disability exams. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. I've done a lot of them, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, I'm going to give the bottom line up front, the gist of this talk, because it's going to be rather long. The first thing is, American doctors and patients are obsessed with tests and have things backwards. In the real world of medicine, what the patient tells the doctor, the medical history, is the most important factor in evaluating a patient. The second most important is the physical exam, and the least important is the tests. And in back problems, we're talking about MRIs, X-rays, CT scans, nerve conduction studies, and bone scans. So it's very important to describe your back problems accurately in detail, because that is basically what's going to either win or lose your disability claim. #2, simply stating that you have pain is not enough to get a disability claim approved. Social Security also requires objective evidence of disease, and the disease must limit the ability to work. On their website, they write, "Just pain is not enough. You must have objective signs and limitations of work-related abilities." #3, tests such as MRIs are viewed by Social Security as confirmatory evidence, not primary evidence that you have a back problem. On their website, they say, "We will not use finding on images or other diagnostic tests as a substitute for findings on physical examination." #4, doctors doing disability exams talk to patients, they get a medical history, and they do a physical exam. They do not read records or look at pictures from imaging studies. So don't bring your medical records or MRIs. Now, some of you may be saying that these rules are unreasonable. Please understand that I'm merely conveying the information from Social Security. I don't run Social Security, and I don't make the rules. At times, I somewhat disagree with their rules, but complaining to me or leaving angry comments on this video won't change anything. If you do think the rules should be changed, I'd suggest writing to the Social Security Administration and to your congressperson and senator. That may actually get something done. That won't stop the people with antisocial personality disorder and borderline personality disorder who sometimes leave adult temper tantrums in the comments, but that's fine. I find those comments interesting and entertaining. So let's talk about back problems. The back is a somewhat difficult part of the body to assess. For one thing, it's mostly hidden. It's under deep tissues. For another thing, it's composed of many different tissues. The back is composed of muscles, ligaments, bones, discs, joints, and nerves. Unless operating, the doctor can't actually see somebody's spine and can barely feel any of it. And studies such as MRIs only produce vague, sort of shadowy pictures of what's inside the body. So let's talk about what to do if you're claiming disability for back problems. The first thing is, not all serious back problems include pain. Later in this video, I'm going to be talking about a serious back problem, lumbar stenosis, which Social Security definitely considers can be disabling, that usually does not include back pain. At the beginning of this video, I said that what the patient tells the doctor is the most important part of evaluating back problems. So here's what you need to know. It's important to tell the doctor in detail and accurately about all of your back problems. And if you have back pain, you must tell the doctor that you have pain. I can't count the number of patients who started telling me all sorts of things about their back, but haven't mentioned if they have pain. And then when I ask them, does their back hurt, they look at me like a moron and say, well, of course it does. Keep this in mind. Disability doctors are not supposed to guess, and they're not mind readers. If you have pain, you must say that. And it really helps if you can point with one finger to where the pain is the most severe. Second, you should also talk about whether the pain spreads anywhere. Does it go to other parts of the body? The doctor also wants to know what makes the pain worse. Things such as bending, walking, heavy lifting, etc. Also, is there anything that helps the pain? That can be things that you do, such as lying down or using a heating pad, or things that doctors have done that have helped, such as injections or surgery. Also, are you taking any medicine for your back problems, and are they helping? And very importantly, and often forgotten, are you having any disabling side effects from those medicines? Narcotics and muscle relaxers, often prescribed for back problems, frequently cause drowsiness, forgetfulness, difficulty concentrating, and sleepiness. When it comes to limitations of work-related activities, think about whether your back issues cause trouble with sitting, standing, walking, lifting, including heavy lifting, carrying, bending, stooping, kneeling, and crawling. Do you have limitation of range of motion? If you've had back surgery, the doctor will want to know when and what were the results of the surgery. Did you get better? Did you get worse? Or did things stay the same? I'd also like to point out that if you've had back surgery, Social Security considers the operative report, the dictated report from the doctor who did your surgery, very important. So make sure that a copy of that is sent to Social Security. Also, when it comes to doctor reports, you should know that Social Security does not lay much stock in reports from chiropractors. Now, I like chiropractors, and I've had chiropractic care for neck and back problems and have had a great deal of assistance. But chiropractic reports are unlikely to win your disability claim. Social Security prefers reports from medical doctors and especially specialists such as orthopedic surgeons, neurosurgeons, and neurologists. Next, I'd like to talk about what to do during the physical exam if you have back problems. And the first thing is cooperate. I frequently get patients who are uncooperative or are exaggerating or pretending to have back problems. There are few better ways to have your disability application wind up in the dustbin. Most doctors have a lot of experience with patients pretending and exaggerating and being uncooperative with back exams because back pain is one of the favorite ruses of people with prescription drug addiction to get doctors to prescribe them addictive drugs. And therefore, a lot of doctors regard patients complaining of back problems with some suspicion. Doing your best and being honest are important in any disability exam, but I have to stress they are very important if you're claiming disability for back problems. Now, that doesn't mean that you have to hurt yourself by forcing yourself to do things that are very painful. I tell everyone I'm not there to torture them. Social Security wants to see what you could do reasonably comfortably over an 8-hour workday, not what you could force yourself to do once and then you'd have to go home and lie down for the rest of the day. If the doctor asks you to bend forward as far as you can, and the best you can do is only bend forward 10 degrees, then bend forward 10 degrees. Then the doctor will see that you're attempting to bend forward, that you have severe limitation of bending. That will go in your report, and that will help your disability claim. If you sit there like a bump on the log and say, I ain't moving, that will go in your report, and your disability claim will likely wind up in the waste bin. The doctor should look at your back and feel your back. The doctor should check your range of motion, having you bend forward as far as possible, backwards, and tilting to each side. Examination of the nerves in the legs is a crucial part of the back exam because the nerves that come out of the spinal cord in the back go to the legs and supply all the feeling and strength in the legs. And many back problems will result in compromise or damage to those nerves, leading to numbness or weakness in one or both legs. The doctor should check your ability to feel each leg and the strength in each leg, and should check your reflexes with a reflex hammer at the knee and at the ankle. Also, the doctor should observe you walking, and if possible, have you walk on your tiptoes, on your heels, and squat down as far as possible, and then rise up. Now, most back problems for which people claim disability involve back pain. But as I mentioned earlier, there is a condition called lumbar stenosis, which Social Security considers can be quite disabling, where people suffering from it often do not have any back pain. In lumbar stenosis, the spinal nerves are squeezed or pinched inside the spinal canal. These people tend to have pain in their legs, not their back, and that pain is brought on by leaning backwards and by walking, and is usually relieved by bending forward and sitting down or resting. It can be quite disabling to the point where the patient can barely walk a few yards. A good thing about spinal stenosis is that it can usually be relieved with surgery. I had a friend who had severe spinal stenosis and was very limited in his ability to walk. And he had surgery, and he told me he felt like a new man. He could walk perfectly fine after the surgery. And one more important thing. Many people with severe back problems use what Social Security calls assistive devices. These are canes, rollators, walkers, walking sticks, wheelchairs, etc. If you use an assistive device, Social Security considers that very significant and wants the examining doctor to see how you do without it and with it. So please bring your assistive device. I've had lots of people tell me, well, I usually walk with a cane, but I left it at home today. In that case, I can't make any comments about whether you need it or not. So, to sum up, the most important things in a back problem disability claim are to describe your issues in detail and accurately using your own words, avoiding medical jargon, and to cooperate as best you can during the physical exam without overdoing it or injuring yourself. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.